Hello everyone. One of the common thing which we all see is like cancer is a deadly disease. Why we think cancer is a deadly disease? Most of the time, cancer is approached as a genetic disease. All the treatments, whatever is available today, be it chemotherapy or target therapy or immunotherapy, we are targeting some genes which are mutating inside our body. Are we applying the failed concept again and again? One thing which we all should understand is cancer is not just a genetic disease. Cancer is a combination of metabolic dysfunction which leads to a genetic mutation, that is, your genes getting mutated. So, most of the time when we step into a hospital, our doctors ask, I want to check your biopsy to see that what is the type of your cancer. And then I want to do a special test, that is a gene test, which helps me to understand what kind of genes are mutated inside your body. And based on the mutated genes, I'll be supplying you the drugs. But whenever we take the drugs, of course, for some time, we feel that our body is responding. We get good scans. And later, after 3 months or 6 months, what we are observing, the cancer is coming back. And then what happens? Again, we go for another set of tests. By then, there will be a lot of other genes which might have mutated inside the body. And this is going to be a vicious cycle till the patient is having that energy inside the body. What we are not looking in general, 99% of the oncologists or the hospitals which are leading with cancers are not looking into is something called the metabolism. As a child, when we are born, there are small cancer cells which are present inside our body because the mistakes which the genes make inside the body is minimal because there is no much metabolic disturbances for us as a kid. Because we are not taking too much of sugars as a kid, we are very active, we are less stressful. So our food habits are also related to that. But as we grow up, there are the cancer cells, the gene mistakes are becoming larger. That is why we are getting symptoms like cancers. And alongside, as an adult, we face a lot of stressful situations. Our food habits are not proper, our sleeping habits are not proper. This favors a genetic mutation environment which leads to cancer. So now, should we target the symptoms or should we target the cause? We should definitely target the cause, that is a metabolic dysfunction, if at all we want to cure cancer. So when there is a constant disturbance in the body, it can be the toxins. Toxins can be the drugs you are taking on a day-to-day basis, your anti-diabetic medications or multiple drugs which you are taking for no matter. The toxins can be the emotional traumas you are facing. The toxins can be the lack of physical activity you are having. This leads to a huge stress of a generally normal cell inside the body. And the cells become weakened. And when we are stressed, what happens? The oxygen exchange inside the body goes less. The oxygen exchange inside the body goes less means you are in a hypoxic environment. And in the hypoxic environment, most of the healthy cells struggle. But cancer cells modulate the hypoxic environment in favor of it. That means the immune system becomes weakened in terms of when there is a low oxygen levels inside the body, the cancer cells start thriving inside. So that is why the cancer cells start eating sugar through something called glycolysis, the Warburg effect, which you all might be knowing, where it start utilizing all the things to produce sugar inside the body. And alongside what happens, it becomes resistant to the therapies which you are doing. That is why some drugs work for some people, some drugs does not work for some people. So the moral of the story is, all these years we are repeatedly targeting the genes which can get modulated in next second. Whereas the change in metabolism is a constant phenomenon inside the body. Depending upon the stress level, depending upon the food you eat, depending upon the concepts which you have about disease also can induce the metabolic dysfunctions of the body. Do not target the effect, target the cause. That can be a long-lasting, sustainable approach to treat and cure cancer. Happy healing.